नमस्कार, स्वागत है आपका आवाटावा न्यूज़ में। मैं हूं अमितोज। आज है 15 दिसंबर 2020। आज हम देखेंगे आजकल की मेन घटनाएं क्या चल रही हैं। मुख्यतः किसान आंदोलन है, कोविड-19 है। आइए उसका विश्लेषण करें, उसके बारे में जानें दुनिया भर की वेबसाइट्स में और कहां-कहां क्या लिखा जा रहा है।
किसानों की ही बात को आगे बढ़ाते हुए उनके लिए सुनियोजित, संगठित और सुरक्षित कृषि उपज मंडियां बनानी चाहिए। उपज का मूल्य बेहतर से बेहतर मिलना चाहिए, बाजार मिलने चाहिए, नवीन मंडियों का निर्माण होना चाहिए, समर्थन मूल्य बेहतर मिलना चाहिए और अधिक से अधिक उत्पादों पे मिलना चाहिए और अधिक खरीद होनी चाहिए। गवर्नमेंट को उनको समर्थन देना चाहिए, हर प्रकार की गारंटी मिलनी चाहिए, हर प्रकार का फाइनेंस मिलना चाहिए और एक सहानुभूति पूर्वक संवेदनशील रवैये के साथ सरकार को किसानों के लिए कार्य करना चाहिए। देखिए, ये प्रदर्शन लगातार होते रहते हैं। कुछ महीने पहले यूरोप में हुआ आंदोलन है, उनकी तस्वीरें मैं दिखा देता हूं आपको। ये जर्मनी का आंदोलन है 2-3 महीने पहले। अब पुनः नीदरलैंड वगैरह में सब जगह फार्मर कहीं ना कहीं आंदोलन करते रहते हैं।
यूरोप में सब तरफ कोविड-19 के चलते एहतियात बरता जा रहा है और चेतावनियां दी जा रही हैं और हार्ड लॉकडाउन लगाया जा रहा है, चाहे नीदरलैंड हो, चाहे यूके हो, चाहे जर्मनी हो। तो उसमें बार बार ये आया है कि क्रिसमस के और ये फेस्टिव सीज़न के में लोग आपस में ना मिले जुलें, दूरी बरताएं और जो कॉशन के हैं, इसमें प्रिकॉशंस हैं कोविड-19 के रहते, उनको फॉलो करें। आइए एक रिपोर्ट देखते हैं यूके से, क्योंकि वहाँ वैक्सीनेशन भी पहले शुरू हुआ है। तो एक अंग्रेज़ी में रिपोर्ट है, निष्कर्ष मैं बाद में बताता हूँ।
Surgery, the first GP practice vaccinations were getting underway. Outside, the virus was continuing to wreak havoc. The news that Greater London, parts of Essex and Hertfordshire are to be placed into Tier 3 came as no surprise, although the disappointment was palpable.
Our NHS is straining every sinew to cope with the pressures, as they always do, but if cases continue to double, even they will be overwhelmed. So we must act now to shift the curve, because when the virus is growing exponentially, there is not a moment to spare.
More than 10.8 million people in this area will be affected from just after midnight on Wednesday until it lifts on December the 23rd to allow people to form Christmas bubbles. This now brings the total number of people in England in Tier 3 to more than 34 million.
The increasing areas are rising faster than the decreasing areas are falling. And as things stand, we are heading into the Christmas easing with diminishing headroom. The buffer zone these tiers were supposed to provide is getting much thinner.
From Wednesday, food and drink venues will once again become takeaway and delivery only. There'll be no mixing indoors or in most outdoor venues except with your household or your bubble. Although shops, gyms and beauty salons can stay open, and people will be encouraged not to travel outside the tier. In November, London had the third lowest regional rate, while Yorkshire and the Humber recorded the highest. Now they've swapped places. And one cause, the Health Secretary said, could be a new strain of the coronavirus identified in southern England.
Over the last few days, thanks to our world-class genomic capability in the UK, we have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant.
It is still unclear, though, whether this variant is having an impact.
It does appear to be in an area of the country, particularly Kent and bits of London, which are increasing rapidly. Now, we don't know what's cause and effect. Is it getting more frequent because it's in a part of the country which the rate of increase is going faster anyway? and therefore inevitably it's a higher proportion, or is it that this virus itself is possible to transmit more easily?
Cases of COVID-19 are rising across the age groups, but in Wales, classes went online today and a number of schools defied England's government with plans to do the same. But the good news is the vaccine. In Scotland, they began giving it in care homes.
Your election item for me? Accept. Subscribe.
In England, vaccinations in those 80 and over and care home staff were able to start if they could get to the GP surgery.
The logistics are enormous, harder than in hospitals because they don't have the fridges here to store the vaccine at -70. So once it's thawed, it has to be used within 5 days. At this surgery, they think they can do about 300 patients a day. And then they have to find room for them to wait for 15 minutes in case of an allergic reaction. So they need more space. How are you going to cope?
So it is incredibly challenging. I kind of call it a quadruple threat of, not only business as usual winter, our busiest time, also our flu immunisation campaign is the largest that we've ever had. There's COVID, it hasn't gone away of course, and then there's a COVID vaccination program which is the largest of its kind, completely new service. So everyone on the ground here from GP practices to GP providers are all pulling together to deliver against those risks.
It's 28 days between the first vaccination and full protection with 2 doses needed, and in between is Christmas. It would be unfair to blame the turkey, but in the US, infection rates and deaths have soared after the Thanksgiving celebrations, and here there are fears that the 5 days of Christmas granted by the government will see a similar surge.
Well, let's talk now to 2 professors there, but
निष्कर्ष ये है कि कोविड के नए नए स्ट्रेन आ रहे हैं और वैक्सीन जो फाइज़र का है वो 2 डोज में लगेगा, जो कि 28 दिन के जिसमें ये शेड्यूल आएगा उसका। और इस वैक्सीन को रख रखाव के लिए -70 डिग्री की स्टोरेज चाहिए। तो भारत देश में इसको संचालित करने के लिए उसी तरह से ढांचागत सुविधाएं बनानी पड़ेंगी और प्लानिंग के साथ ही ये आ पाएगा। आज के लिए बस इतना ही। प्लीज़ मेरे चैनल को सब्सक्राइब करें, शेयर करें, लाइक करें। धन्यवाद।